Welcome back to the Tales of Truth podcast, where we tell the truth about veterinary medicine. I'm Dr. Angie. I'm an integrative veterinarian, and I am joined with my veterinary nurse, JoJo. And today we are talking about all the fear, guilt, and shame we experience when we are responsible for taking care of a pet, whether it's a cat, dog, horse, bird, spider. There can be so much pressure, so much fear, and a boatload of shame around what you are doing, what you're not doing, and what you should be doing. What are your thoughts, JoJo?
The should. I'm living in the land of should. Yeah. I feel this on such a deep level. So much so that I don't want to do this episode.
Well, should I start? Should I
you're gonna
shame? We'll shame Dr. Angie first.
If you bring your shame to light, apparently it feels less so, according to Brene Brown, for those who know
I know.
Brene.
Well,
let's bring it to the light.
Let's talk about this kitty under the light right
Yeah.
now. This is my cat Fritz. I don't know if he's around here somewhere. I can show you. So Fritz belongs also to his sister Fiona here. I got them when they were about 16 weeks old, and they're 2 now. And Fritz is fat, and I know that I should be doing something about it, and I can't do what I know I should be doing. So Fritz and Fiona, they eat an exclusively raw diet, either freeze-dried or frozen raw. And Fritz is one of the very few cats that has managed to over-consume calories on this said raw diet. I always
love
tell
him
people
for
like
this. Go Fritz.
so relatable, right? Like,
Yes.
he's just super
Get your
into
chub
eating.
on.
Get your chub on. He wants to eat. And his sister could care less about food. And what I need to be doing is counting calories and separating them while they eat, but just feeding them and just feeding everyone in my house, myself, my kids. I have food sensitivities. Everyone wants to eat something different. And I feel so lucky that the cats eat it all. And when they're hungry, I just feed them. Because if I don't feed them, they are so annoying. They will hop up on my mantle and start eating my plants. It's like, so Fritz has adopted this behavior. Well, he's going to jump up and he'll get the spider plant, the snake plant, all my succulents, and he chomps on them and looks at me. And he's just like, I'm so hungry that if you don't feed me now, I'm going to ruin all your plants. And so I just feed him whatever he wants to eat. But what will happen is I'll put food down. Fiona notices I put the food down and then walks away because she doesn't care about food. And then Fritz eats it all. So what I should be doing is counting the calories and separating them somehow. And I can't. And I know that all of that extra weight is bad for his joints. He's only 2. I know that it causes more inflammation. I know that it's bad. And I can't do anything about it right now. And I kind of won't.
When you say can't, you mean like you feel limited? Is that like resource limited? What do you mean by can't?
This is good. Let's therapize me. Yes. Yes, it's true. I can't. And when I say maybe I won't, maybe it is more that I can't. I'm a single mom with 2 kids. And like every day, I'm just barely making things work. And I love these cats are like the center of our lives and our household. But like the thought of having to do that, I just can't. And I feel there's not a day that goes by where I don't feel awful about it. Because, and I'm sure we're going to get nasty comments. I'm going to say it anyways.
I'm afraid of that.
And
Yeah.
I guess let them come. I guess let the judgment come. But there's not a day that goes by where I don't feel guilty about it. And like, I should be doing something about it.
I'm going to say the word heard. I hear that. I'm sorry it feels bad for you. Like,
I wish we could just talk to
facing that shit.
Fritz. Can we just talk to
Fritz is happy.
But I know Fritz doesn't understand the consequences of his actions.
And even if he did, would he still choose? I don't know. Right?
I don't know. That is such a good point. If he knew the consequences, I will catastrophize and think I am going to leave Fiona. They're paired and bonded, right? And he's going to die before her. And it's going to be all my fault because she's
Oh,
going to
wow.
be
You're
lonely.
like 15 years down the road.
Totally. Okay.
Oh, man. This is going to be good.
Hashtag hot mess. Like, everyone thinks that veterinarians and veterinary staff, like, we're all taking excellent care of our pets, but we're just like you. We're doing the best we can.
Yep.
Okay, now you go. Don't leave me naked out here by myself.
Oh, it's such a vulnerable place. When you said the comments thing, I'm like, no, never mind. Let's not.
Okay.
Let's not do it. I feel so fragile. But the reason we are doing this, and there's a why. The reason we are doing this is because we see this again and again and again, that people feel so much shame. And so this is really like unmasking, a truth telling.
Yeah.
So I have 2 dogs, and I have a 10-and-a-half-year-old husky, probably some Malamute in there, and a 4-year-old COVID puppy, like, the ones that we all adopted in 2020 that are completely neurotic. There's something wrong with them. And Bodhi is getting old. I can see it. Like, I see the muscle wasting. I see the ways he's hiding under the bed. He's got some weird skin disease thing happening on his nose, his chin. Like, that I started peeling it off and it's been growing hair through it. So that's how long it's been there. Like, there's hair growing through it. I don't know what it is. And I know he needs blood work. I know he needs a dentistry. It's so clear. Like, his gums are inflamed. And here's the thing for those who can see. I have all the tools sitting in my office behind me. I know that CBD works. I know that the perio care works. I know that probiotics work. And I'm not doing it.
Yeah.
And I'm like, what is that about? So I'm often envious of our clients, our customers, our online customers that just order on a regular basis. And I'm like, there's people out there doing it.
I know.
Every day.
Yeah. And it
I
works.
know
And then they
that-
tell us.
Yeah, I know
works.
it works. I know I could take that CBD and it would help me be a little less me. Type A, neurotic, things need to be perfect. And I think that's what it comes down to, the need to be perfect. Because when I take him into a clinic, like, I would feel no shame bringing him to you. But we just don't have the brick and mortar and the things that he needs at this particular time. So I think when I take him in, I fear there's going to be judgment about his behavior because he's a biter, which is not my fault that he's a biter.
No.
But he bites. So I have to get special treatment and I need to get us into a room and blah, 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 blah. I'm not going to give him a lepto vaccine. I'm not going to give him a Bordetella vaccine. So I have to advocate in that way.
Right.
And then on top of it, they're going to look in his mouth and be like, what the hell?
Yeah.
So I feel like it's kind of like I'm avoiding it. I know it needs to be done. I'm avoiding it. And also, let's just be honest, it's about the pocketbook too. Christmas is a really hard time to go now dish out. Like, I've been adding in my head what this is going to cost me. And it's probably going to be easily a $1,500 visit.
Easily.
Because he's growing bumps too.
Yeah.
So we need to do all the things. He needs a tune-up.
He needs a tune-up.
And it's also facing the fact that I know some of the news I'm going to get is that he's getting older. And that's where I can feel my face turning red and I feel sad. Because that's my soul dog. Yeah.
And it's easier to live in that place of denial. And we see that all the time with our clients. We're like, I just don't want to know.
And it's so much easier to be on the side of, it's not your dog. Like, oh, why can't they just see it just needs this? And so I do have those judgments sometimes because it seems so obvious.
Right.
So I think there's part of me that's avoiding what's coming.
Right.
Yeah.
And sometimes just the act of calling to make the appointment or trying to find that time. It's like we wake up every day and we're just trying to get things done, take care of our children, get our work done, and get ourselves to our own doctor's appointments and our own health care. And you've had so much health stuff this year. It makes so much sense why that's not the first thing you're doing at 8 a.m. is finding a vet that can judge you.
Well, and that's, I'm trying to find the right vet. Like, we have a great team out in Boulder that I would trust, but I live an hour from Boulder. So I'm thinking as he's going into his old age, I really need somebody who's like 10 minutes down the road.
Right.
But I've been here, and this is where so many of our clients have been once they get to us, is the amount of pressure to do things that I don't want to do for him. So the thing that I can do is every day he gets Farmer's Dog. And this is like, it's the one thing he will eat every day. Every other food we've done, he's like changed his mind over and over again in this one. So shout out to Farmer's Dog. I feel good every time I open that and see those those veggies and, such. I'm like, I'm doing that right. And they get walks. There's a lot that's going right,
Right. It's so easy to focus on all the things that aren't happening. But yeah, you're feeding your dog like cooked food.
Yeah. I mean, we went through this when he got bit by a rattlesnake, which is a whole story in and of itself.
Yeah.
The amount of pushback that I got about the small things.
Yes.
Just about, I'm like, we're in crisis right now. None of this other stuff matters.
Like what? What'd you get pushback about?
About the lepto vaccine. Like, they wanted to do a lepto vaccine before he left the emergency.
What?
Because it's now a core vaccine.
I know it is. That's insane. No sick animal should get a vaccine. I'm going to get on the soapbox.
And me wanting to do another blood work test, because I don't know if you remember, but there were some things that were off that just didn't feel settled to me. And I'm like, I want to run one more set of labs, because his urine was smelling really like sickly sweet. And it's just like that I didn't have a right to ask for that because they weren't recommending it. I don't know. There was just a piece. So I think I'm really afraid to face that again.
Well, I'm going to tell you that those fears are founded. As someone who does relief, here's what happens. Like, a nurse comes in, or it's often just a veterinary assistant. When I say just, it's not to make them less. But there are veterinary assistants that go into rooms that have these conversations. And they maybe haven't been in veterinary medicine. They're trained to say, here's our package, here's what we recommend. And they haven't been in the field long enough to understand the nuances of like, this is a really inappropriate time to even talk about, is your dog vaccinated for leptospirosis? Right.
I'm like, is my dog alive? That's what I want to know. Yeah.
You're like, my dog is slowly dying in front of you. We might not make it through this. Who cares if we're up to date on leptospirosis?
Yeah.
And I think that's where there's such a disconnect between what the conversations veterinarians want to have. I guarantee you, no veterinary nurse brings a case back to the veterinarian and says, hey, this dog just was bit by a rattlesnake. And no veterinarian's like, are they up to date on their vaccines? No one cares. No. It's not going through our mind. We don't care. Yeah. Oh my gosh.
And that was my first experience with corporate medicine and veterinary medicine. And it was a different experience. But that is, all the small clinics are being bought up. So I'm really struggling to find that good fit place to like, and I took Sage, the 4-year-old, in for, she ripped her dew claw. And because I didn't want to go try another place or advocate for myself, I paid $3,000 to have a toe removed because they had a board certified surgeon. I'm like, great, let's do it.
You had a board certified surgeon.
I did.
Remove a dew claw.
I did. $3,000 later with my discount. But those are the decisions I will make. It's beautiful. Totally.
Her
toeless foot is so pretty. But, like, not necessary.
But you know that boarded surgeon does not care about her vaccine status of leptospirosis.
No. Well, and I think I like that about that place is they were just accommodating. So,
yeah,
I don't know.
That's hard. That's so hard. And I see that. And I see what happens is that, There's some like, okay, well, they declined this, they declined that.
Mm-hmm.
And there's not enough time to just have an educated conversation and a non-judgmental conversation. So I think what we're kind of distilling down, JoJo, is that the judgment starts with our profession. I think we should own that there's a lot of our profession that's, passing on a lot of this judgment when it's maybe not warranted. I don't know. I'm just going to throw that out there.
No, I think it does partially start with us. But I think there are a lot of judgy people, period, out there.
Yeah.
I mean, we've heard it before. And I'm sure we'll do an episode on rehoming, and that
Oh, yes.
will bring up so much tender places in people, some triggered places. Yeah, I just notice my avoidance. And I know you talk about this. You're really open, and this is what gets people to feel comfortable is when you go into an appointment and people are feeling shame around what their cat is eating. It tends to be cats. They'll be like, I know I shouldn't say this word in front of you, but my cat eats kibble.
Yeah.
And then you talk about Simba, your kitty, and you're like, I had this cat, and how it made you feel like a fraud. Do you want to tell that story?
Oh my gosh. Let's talk about my fraudulent feeding I can do it for my pug too, my pug Pugsley. And then my cat Simba. So my cat had really bad IBD. And then I felt guilt. So here, we'll just talk about all the layers of guilt. So he was a vomiter, and I didn't do anything about it. I knew better, and I just didn't do anything about it because I had young children. And so he would vomit, and I just kind of, I don't know what I was doing. And so then one day I just went to go pet him, and I was like, Simba has lost a lot of weight. He was like skin and bone. And I was like, Simba's dying. And I thought, oh no, Simba got cancer and suddenly lost all this weight. But it didn't happen suddenly. It happened over time. And I felt so guilty that I didn't notice it. And so he ended up having inflammatory bowel disease, which was great. I was for sure thinking he had lymphoma, but he didn't. He had inflammatory bowel disease. And he did the best on Royal Canin, high calorie GI food. I recommend that food all the time. But at the time I was like, I couldn't fix it with a raw diet. I couldn't fix it with all the brands that I would want to feed and that I've represented over time. But at the end of the day, he did super well on Royal Canin. And I, for a long time, didn't want to tell people. I remember I was working for one of my favorite companies of all time, and they were like, what do you feed your cat? I was like, oh no, it's not your food.
Maybe we need to change that question. What will your cat eat? Not what will you feed your cat.
Oh my gosh, that's such a good one.
Just flip
what
that
does
on
your
its head.
cat not have diarrhea on? That's what you feed. And then my pug ended up he was so atopic, meaning that he was allergic to food and the environment. And I did all the brands that I love. I home cooked for him. I tried raw. I did it all. I did at the time the freshest food you could get was the Nom Nom Now, which I think is such a cool brand. It's similar to Farmer's Dog.
Nom Nom Now, yeah.
Yeah, they make such great recipes. And then anyway, so we have all these great brands, and I did that. He just was so itchy, so I finally broke down and put him on Ultimino, which is a really hydrolyzed hypoallergenic food. He was so happy. He was so much more energetic. He finally put on a little bit of weight. He didn't have gas that would infiltrate the whole house. And I think he always had a stomach ache. And when I put him on the Ultimino, he did great, and I never took him off. And so when people would say, what are you feeding your cat and your dog? And so at the time I had a cat and a dog, and I was like, oh, just Royal Canin. I'm an integrative, holistic veterinarian only feeding Royal Canin. Which is, I thought what I should be doing is figuring out how to make it work. And I thought if anyone could do it, it's an integrative veterinarian. It's you, Angie. You're supposed to have the answers. And at the end of the day, the technology that was in that food worked so well for my pets.
Yeah.
Humbling.
That's
And shout out to Royal Canin. Thank you.
Yes. It's that piece of just, better. Or this idea of, I know better. or I can see there's something going on with Bodhi's nose. Like there's something.
Right. There's something.
But I also had this idea that I should know. I should know what it is. Why don't I know what it is?
Well, this is a little segue, and if you need to pull me back in, rein me back in. But that's always JoJo's job, is to keep me
To
like
reel you back in.
organized. No. Yeah, totally. Like
Go
every
off
single
the
day.
rail, Angie. Go.
So there's this idea that just because we should do something, or just because we can do something, let me say it the right way. Just because we can do something, should we do it? And I find this a lot with like veterinary oncologists and internists, is that sometimes they take my cases further than I think anyone should take a dog or a cat. Like just because you can treat them doesn't mean you should. And I think especially as our pets age, and I think it's a good conversation to have about Bodhi, like because he hates veterinary care, and it's like, where is the line? So let's say we did a biopsy, like, or would we do a biopsy? Is that nose thing bothering him, or is it just guilting you?
It's bothering him. Like he's out on the
Okay.
cement, rubbing his nose.
Okay, so
So
we should do
it's
something.
time.
Yeah.
I was just trying to put all the puzzle pieces together so I have the answer before I go in.
Right. Well,
But
I mean, I guess
that's
the worst thing
not
it could
gonna
be
work.
is some autoimmune something,
Yeah. I don't know.
or
Something's
it's just
something's
really bad
changing in him.
pyoderma.
Yeah, he's
Yeah.
10 and a half. Something is shifting. And 10 and a half doesn't
Yeah.
sound that old, but it is when you're a 70-pound dog.
Yeah.
Yeah. I'm just
Yeah, because
seeing
what
it.
we think the average lifespan is like, what, 12 for a
Yeah.
70-pound dog.
Ugh.
So,
It's when it comes to
mortality.
when it comes to our own pets, and I see it all the time. We don't know the answers.
Oh my
If it's
gosh.
your pet, it's so
No.
easy. And I can remember coming to your house once and seeing Simba, and I'm like, "Oh, Angie, he's losing weight." And you're like, "Is
Yes.
he?" Because it's so hard when it's right in front of you, and
Yes.
when you have the attachment. And so I have so much empathy when people are in that space of not really knowing what to do or being afraid to uncover the answer.
Right. Because when Simba was dying, so then eventually years and years later, Simba went on to develop lymphoma. And I think you would come over and I'd say, how does he look now? Was
Yeah.
that right? Yeah. I'd be like, because I couldn't assess.
Yeah, and there
I
was a
was too
time when it
close.
was like, oh, that's a vast difference. Like there was a time in just maybe
Yeah.
a week or two where I could see. But it's hard. Like when it's like when you look at yourself in the mirror every day, you don't see the changes that other people see.
I
But to
know.
bring us back in,
Okay.
we
So we're
see this
back.
with our pet parents all the time. The things that they're
Yes.
afraid to say to us, the things they're afraid of being judged for, the things they want to hide from us.
I know.
And it can span like we have a pet in the practice right now. So this just made me feel so sad. It was the first time she went to the brick and mortar clinic. She was shamed for feeding raw. Like and the appointment was nothing to do. It was for a broken bone. And yet she was
Yeah.
being shamed for feeding raw. And then this kitty's on rest for weeks, months, I think, almost 2 months. And now she's gone in and the cat's gained weight. And she got the talking to about her cat gaining weight. And I'm like, she can't win. She
She
can't
can't
win.
win.
Like, the cat's been on rest, so the cat gained weight. Makes sense.
I know. I know. And I know which client we're talking about. She tries so hard.
So hard.
So hard. She takes such great care of her animals.
Yeah.
And yeah, that is hard to watch that happen. And I see so many of our clients being they feel guilty when they can't pay for something, when they
Oh,
can't
yeah.
afford something. And unfortunately, in veterinary medicine, a lot of life or death situations come down to not having enough finances. Like that is a reason why
Can we jot that
some.
down to talk about insurance on an episode?
Oh my gosh, yes, let's talk about insurance. And until then, everyone get insurance. But yes, I mean, not having enough money. And I always tell people, like, I insure my two cats because I couldn't afford veterinary care otherwise. Like, there's no shame. Like, I want everyone to know veterinarians can't afford veterinary care either. It's just like how, you know, your GP that you go to, they couldn't afford, you know, a surgery without insurance either. Like no one else
Hmm.
can afford veterinary medicines. It's not just you. It's not just you. It's really expensive because it's
So
getting better all the
expensive.
time.
Hmm.
Technology is good and it's expensive.
That is so true. And I know that's a piece with Bodhi is I'm just like, okay, when does the pocketbook say now is okay? Now it's okay to go spend that 15 to 2,000, 1,500, depending on what they learn. But yeah, people feel a lot of shame. They feel shame about what they're feeding. They feel shame that they didn't get care every year. They feel shame that, they didn't notice something sooner. They didn't
Oh my
notice,
gosh.
oh, their pet's pain. That's one. When pets are masters at disguising pain.
Yeah. Especially
Yeah, we see a
cats.
lot of it. Yeah, especially cats.
Yes.
And there's
I see a
no
lot of
room
people.
for it. That's what I want to say. There is no room for shame. I don't care the situation unless you are absolutely abusing an animal. I mean, that is a line.
Right.
But when people are just trying to survive and make it, like I hear that, I've heard that about the unhoused population that have pets.
Yeah.
And people are like, they don't have a right to have a pet. And what I see is those people will go out of the way to make sure the pet is cared for in a way in which they have companionship and and maybe I'm going off the rails, bring me back in. I've gone
I
off
don't
the
think you
rails.
are.
I'm like, that's a whole nother thing. I feel worked up about that. I'm like, that pet is loved and is offering support that we aren't offering to that person. And
Right.
there's some mutual beneficial it's a mutually beneficial relationship from what I can tell. They're rarely skinny pets.
They're rarely skinny. They're well exercised.
Yeah.
They're outside a lot, unfortunately.
On
But for
leash
the
though.
dog,
Yeah.
they're living a good life. And I think just because you can't afford the big interventions doesn't mean you don't deserve to have a pet. Although this is a conversation I see a lot of veterinarians having online now, and some veterinarians would say, "Yeah, actually, you don't deserve to have a pet, and you shouldn't have a pet." And as
Mm,
someone who's in my adult life, my financial situation has varied so greatly and in ways that I couldn't have ever predicted. I don't think you can commit to a pet and that's going to live 10 to 20 years and know exactly where you're going to be financially and have all
mm,
the answers. Another plug for insurance. But I think that, or if you're not like, I still deserve to have Fritz. I'm going to just say
mhm.
that you still deserve to have Bodhi. We still deserve to have these pets, even though maybe we're not doing everything we can all the time.
Can I just let that sit? Sometimes I just feel someone can do it better. Uh,
I mean, I guess they probably could, but it wouldn't be you. And at the end of the day,
no,
our
and I
pets are
know
so
that he
bonded
is
to us.
so loved and so cared for. Yeah. And he chose me. I'm just gonna say it.
He did choose you. Yes. And there are a lot of things we're not doing for ourselves. So sometimes when I say, like, gosh, I wish I could make Fritz's calorie consumption perfect, but I wish that I could eat less processed foods and I wish I worked out more. And so all I can do is every day just make the best decisions. And I think that's the same with Bodhi is like, all we can do is just notice the shame and try to make the next right step when we can make it, and expecting yourself to make that next right step over the holidays when all your kids are home from college might be a little bit
Right.
much. Okay, well, we would love to hear from you. Yeah, how do you feel guilty? And then how do you deal with your shame? And how do you give yourself grace when we're not all doing it as perfectly as we could or as perfectly as someone tells you it could be done? What do you do? We'd love
Mm.
to hear from you. Leave us a comment below. You can find us at Natural Cat Vet or Boulder Holistic Vet. And if you want to have a more in depth conversation about what you can be doing for your pet, you can book a consultation with me online at boulderholisticvet.com. You can go to our online consultations. And JoJo, is there anything else you'd like to say before we wrap it up?
I think it's perfect timing because it's saying my internet's not stable.
Okay, not stable. Okay, well, we will see you next time.